the work we've published as an abstract for the moment in BSH is looking into the real world outcomes of an ALCL, large ALCL population that has been treated with whatever standard of care there was in all the institutions that have participated. The rationale for this work is basically the lack of specific data on ALCL, because most of the clinical trials we have seen published lately, whether they are prospective or retrospective, and all the commercial trials that have used brentuximab, which is the drug that is going to be recently incorporated into the therapeutic armamentarium for frontline ALCL, have all been a mixture of T-cell lymphomas, and that is just a function of how rare these diseases are. So people tend to kind of cluster the different types of T-cell lymphomas in one study, and then it makes it quite difficult to draw conclusions specifically on each subtype of lymphoma. However, and the importance, I should say, of analyzing separately ALCL is that the approval of brentuximab for the frontline treatment of ALCL is done basically based on the Echelon trial, Echelon 2 trial, which has looked at a wide variety of T-cell lymphomas, but actually this more important benefit of this combination of brentuximab plus CHP was found for ALCL, actually. We had quite difficulty finding good data on how actually do the ALCL codes perform on their own. So, as I said, they're all pooled data of the different subtypes of lymphoma, and we've decided to do this retrospective study basically to give a baseline or a benchmark of performance of ALCL patients that could be used to then analyze whatever happens after we introduce the brentuximab into first-line therapy, and then kind of make a real-world comparison that would be fair and well matched with consecutive patients to then have a good idea whether or not the brentuximab has significantly improved the outcomes of our ALCL patients. So basically, that's the rationale behind the study, and we've collected quite a lot of patients with ALCL. I think it's one of the largest cohorts that has been put together specifically for this. And basically, the main preliminary results that we've found is basically that the outcome of the CHOP treated cohort, which is probably the standard of care to which the brentuximab CHP treatment will be compared to, is probably less good than it's been originally thought, which is a factor of the real world situation and the analysis of all comers as we've done. And basically the other important finding is that we've found a very, very small percentage of patients who have been autographed first line, which is in theory the ideal or the consensus for treatment of these patients to have autologous stem cell transplant in first as consolidation of first line therapy. And the clinicians and the investigators who have provided patients for this are very much aware of this. is not a clinician decision, but it's just a reflection of the reality of these patients, and that basically the majority of them are actually not fit for an autologous stem cell transplant. So, as much as we know that there have been different studies that have demonstrated that the transplant is probably beneficial in this setting, the actual people who is getting to is quite limited, or the actual, or quite reduced, I should say. And that's basically it. We're kind of analyzing and trying to determine, the outcomes of different first-line treatment approaches, and basically trying to compare the standard CHOP versus the CHOEP, which is also a good a matter of debate at present. We're trying to see if we have enough number of patients to draw any meaningful conclusion about this. That is work in progress, and I don't know if we will be able to do this, but we'll certainly give it a go. And basically, I think that's the gist of it. I think we will hopefully publish this quite soon, once we finish the statistical analysis, and hopefully will provide some important piece of information for the UK ALCL or lymphoma community in general.